Let's have a discussion about contraceptive options and what they'll do to your period. In order of what you have to remember least often to most often, there is one hormone-free contraceptive called the Paragard IUD, or intrauterine device. This option contains copper only and prevents pregnancy up to 10 years. It will likely cause periods to be heavier and crampier. Mirena IUD is a progesterone-only option that is good for 8 years. It will make periods shorter, lighter, less crampy, and likely stop periods altogether. Kyleena IUD has the same type of progesterone as Mirena, but contains half the amount. It is good for 5 years and will also make periods shorter, lighter, and less crampy. Most women still get light bleeding each month. The type of progesterone in Mirena and Kyleena can increase your androgen levels, thus causing more acne in some women. IUD placement is done in the office and involves a series of 3 to 4 strong period-type cramps and takes only a couple minutes to place. The Nexplanon device is a small progesterone-only rod that is placed under the skin in your upper arm and is good for 3 years. The number one side effect is abnormal bleeding. This can mean no period at all or very sparse light bleeding, but can also mean more frequent or prolonged bleeding. Depo is a progesterone-only injection that is given in the arm here in the office every 3 months. It tends to stop periods altogether, although some women can have some spotting after the first couple injections. Depo has a tendency to make people hungry, so weight gain is a possible side effect. It also decreases the density or strength of your bones, so if you choose this option, it is wise to begin a multivitamin or a calcium and vitamin D supplement. The remaining options contain both estrogen and progesterone. Any option that contains estrogen increases your risk of blood clots, which increases the risk of heart attacks and strokes. The normal person has a risk of 3 in 10,000 people. Adding estrogen increases the risk to between 6 and 12 in 10,000 women. People with a history of blood clots or clotting disorders, migraines with an aura, or nursing mothers should not use estrogen. NuvaRing is a very flexible ring placed in the vagina and left for 3 weeks at a time that cannot be felt when placed in the correct position, just like a tampon. You have the option to remove the ring at the end of this 3 weeks and leave it out to induce a shorter, lighter, and less crampy period, or you can remove it and immediately replace it with a new ring to skip periods. NuvaRing can be felt during sex but has no sharp edges and will not be painful. Xulane patches are placed on your low back for a week at a time. You have the option to have a patch-free week during the 4th week of this cycle to induce a period, or continue with patches to skip your period. If you choose to have a period, it should be shorter, lighter, and less crampy than normal. To state the obvious, this is the only option other people can see, and if it does not stick, it does not work. Last are the birth control pill options. These have to be taken around the same time each day and will make periods shorter, lighter, and less crampy. There are also progesterone-only pill options for those who need to avoid estrogen and are uninterested in the previously mentioned estrogen-free options. We can review any of the options you wish to learn more about.